73-year-old Chandra Maya lives alone. Yet, in Nepal, it is customary for an aging mother to live with one of her sons. Of her 4 children, Chandra Maya's daughter is the only remaining child living close by. And now, in just the last 3 months, her eyesight, like so many other aging Nepalis, has been completely blocked by cataracts.
A country like Nepal, which is agriculturally subsistence, people tend to live in mostly joint families. The persons, whether a male or a female who is blind, is an extreme burden to the family, both social and financial burden. What happens in the initial phase is a bit of sentiment, and if there are some strong sons and daughters, they tend to look for a couple of months, you see, giving them food in the morning and food in the evening and looking after them. But then after about 2 months, you know, the realities of practical mechanics takes place, and then that is not possible for the families to continue. So they often are left to stay in a corner like an animal.
No मिठो लाग्छ नि, न मिठो लाग्छ। यो आँखा देखे त नि म यसो आलु पनि गोड्थे लाग्छ। मलाई न मिठो लाग्छ नानी।
बजी पिड नमान्नुस्, पिड नमान्नुस्।
न मिठो लाग्छ। छोरा छ विदेशमा। 3 भाइ छोरा छ। 3 भाइ छोरा छ मेरो। न मिठो लाग्छ मलाई।
The people start having this total fear for light, and they just crumble together. And I think in the course of process, they develop psychological breakdown. The good thing about cataract surgery is, if surgery is done, I have seen many instances where all these processes have reversed in a very short span of time. That's what's most forthgiving for the surgery.
Chandra Maya will now embark on her own climb. She and her granddaughter Sita will walk several miles up a steep mountainside to the village of Pha Phlu, where Chandra Maya has heard of the miraculous doctors who might bring her world back to life.
Namaste. She has absolute cataracts in both eyes. I think we should do her left eye today. The pupil reacts very beautifully. You see, when I shine the light, that's an indication that the retinal function is still good. Check out that fang.
After the patient spends a night in makeshift recovery rooms, nurses and orderlies arrange everyone for the doctor's inspection. The eye surgery technique that Dr. Ruit has worked so hard to refine allows patients to have their bandages removed after only 1 night of recovery.
Just Ali Sita Hami Johnson. Just what you boss know.
This is your patient. कस्तो देख्यो है आज है? राम्रो देख्यो?
राम्रो देख्यो।
एकदम
राम्रो देख्यो।
त्यो पर हेर्नुस् त त्यो मान्छे को हो?
मान्छे हो नि।
Come here. You show me your fingers there. Just यो कतिवटा औँला छ?
दुरा।
2. Now. दारी कस्तो रङको छ? कस्तो रङको?
सेतो छ।
सेतो छ।
See, the blind people are blind everywhere. They have the same sentiments, you know, and then after seeing, they're going to express the same sentiments. So I think that's where, and that's why our work is very special. And we should not think about boundaries. I think we should all think about human beings as one big family.